believe in the ripple effect.
What's up? What's up? Another episode of Ripple Effect Podcast. Of course, I'm your host, Ricardo Rendes, also known as Ricky Varandas, and a great episode for you today. Today, we have returning guest and dear friend, Dr. Brian Hooker. He's been on the show a bunch. He's been on initially because he was a part of the CDC whistleblower story, which is a crazy story and gets highlighted in the documentary Vax by Del Bigtree and Dr. Wakefield. If you haven't seen that documentary or looked into that story, please do. But since then, he's been an advocate and one of the most credible voices in the anti-vax movement. He does amazing work for Children Health Defense. He's written a bunch of books. So definitely go to my website or go on Rumble or Rockfin and look up Dr. Brian Hooker and the Ripple Effect Podcast, and you'll find all the past episodes. Today, he's on to talk about the vaccine agenda, and we expand on that topic and much more. So it'll be an amazing conversation. I'll put links to all his work in the show description. But as always, I do have to remind you, this is a Valley for Valley show. I have a bunch of these shows already recorded. I'm trying to get them out as quickly as possible. But because podcasting is not yet my full-time job due to a little bit of a lack of support, and I'm trying to be kind here, but I do get thousands and thousands of downloads every time I upload a show. And I also get many views on all the video platforms I'm on, like Rumble, Rockfin, Band.video, BitChute, and others. But only a small percentage actually donates to the show. And because of that, it's hard to find time to record, book guests, edit the audio, upload the video, and do all the work that's required to put out a good podcast episode with thought-provoking conversations and thought-provoking guests. But if a small percentage of you guys find it in your heart and find it in your wallets to donate as little as $1 a month on Patreon, or donate monthly however you would like to do it, or check out some merch at our merch store, the Ripple Effect Podcast, merch.com will take you there directly. With your help, eventually, hopefully in the near future, I'll be able to do the show full time. And there's other ways of supporting the show too. Financially isn't the only method of helping. You can also rate, review, share the show, tell people about the show, do all that stuff to get the algorithms to work in our favor, because typically they don't, especially when we're talking about a podcast like the Ripple Effect Podcast that doesn't stray away from any controversial topics. Well, that's it. If you do want to support the show, go in the show description. If you get some value out of this discussion or any of the discussions I bring to you, please go in the show description and look for ways that works for you to support the show. And like I mentioned, I already have some amazing conversations recorded, just looking to find time to edit them, upload them, do the thumbnail, do all that type of stuff, and hopefully I can get them to you quickly. And I also have some amazing guests already booked too, and with your support, I can get these shows out quicker. So that's it, guys. Also, check out my other show, The Union of the Unwanted, which Dr. Brian Hooker has also been on. It's a roundtable discussion show with myself, Sam Tripoli, Midnight Mike from the OBDM show, and Charlie Robinson. All our episodes, all the ways of supporting the show, and all my social media accounts can be found on my website, therippleeffectpodcast.com or rickyvarandas.com. So check out the website, check out the show description, because all those links are also there. And I will talk to you guys in the next one. Enjoy. Peace. Let people know a little bit about your background, and let's get into some of the topics that you want to discuss today, some of the topics that maybe aren't on people's radars that should be.
Right, right. Well, I'm Brian Hooker. I have a PhD in biochemical engineering, and I have been studying vaccines and vaccine adverse events for over 25 years now. I've really devoted, the sort of the tail end of my career to do that full time, as I'm the Chief Scientific Officer of Children's Health Defense, the organization that Robert F. Kennedy Jr. started in about 2014. We were called the World Mercury Project back then. But one of the main aspects of what is done at Children's Health Defense is to look at vaccines and vaccine injuries and try to understand and educate the public better, regarding these quote unquote prophylactic interventions and what they can actually do, and that they can and do all the time cause harm.
Yeah, you've had a couple things on your radar of late in regards to potential
Yes.
new vaccines or new viruses that they might be trying to scare us with. What are those things that you've been researching?
Well, first and foremost, I've really want to get out in front of this scare about the bird flu. And, there's a lot of fear porn that is hitting mainstream media as well as social media. And there's some main players on social media that are really pushing this narrative regarding, disease X, the next pandemic being bird flu, which would be H5N1 um, flu influenza that is making its way through uh, uh, poultry farms, as well as now it's actually in cattle in the United States. And, there have been only 3 infections in humans in the United States in this, latest round of bird influenza. And 2 of those resulted in pink eye. One was in Texas and one was in Michigan. And then the third, which was just reported at the end of May, resulted in a cough and an upper respiratory infection and no fever. All of them resolved without incident. I believe that each one of them was treated with an antiviral drug. But something is amiss here. There's really, when you look at the timing of the bird flu, and is it the next pandemic, and should we even be talking about the next pandemic? Should, between the last two, there was 100 years, over 100-year expanse of time. And so, I find it's odd that this has captured the conversation. And when I started to dig beneath the veneer, Ricky, I really saw some things that scared me and that I want to make sure that the public was well aware of.
And what were those things?
And what were those things? Okay, I guess with that I should go forward. Well, it turns out that Um, first of all, gain of function research, the type of research that gave us SARS-CoV-2 through a lab leak through the Wuhan Institute of Virology, that research is still going on and goes on actively in the United States. People will say, oh, well, there was a moratorium on gain of function research and that was enacted in 2014. Well, the moratorium was lifted in 2017. So I just very innocently started to look and find what institutions were doing gain of function research on H5N1 bird flu. And it turns out that there's 5 such laboratories that are doing that work just in the United States alone. Okay, so 5 research institutions in the United States are actively working on taking H5N1 influenza from birds, from mallard ducks, from chickens, from geese, and weaponizing those so they can actually be infective and transmit from human to human. And when you look at their research studies, you look at what they're publishing, they're actually genetically modifying this virus, then passaging it from birds to ferrets. Ferrets are immunologically very similar to humans. And then ultimately, they're trying to use it to infect human cell culture. They take fibroblasts, which is a type of cells a different type of cells. The fibroblasts that they take are specifically from lungs, and then they infect those in the lung tissue, and they're trying to make it so the virus will infect and passage in human cells. And that's, to me, it's unconscionable. I couldn't believe it when I actually saw the research, and the institutions include the University of Wisconsin, which has been doing gain of function research on bird flu since 2006. They also include the influenza division of the CDC, and the CDC has been on board with this type of research since 2012. The USDA has done gain of function research in their Athens, Georgia facility. They have a facility called CEPRL, and CEPRL has been doing gain of function research on bird flu for many, many years. One tie that really, kind of surprised me was St. Jude's Hospital has been looking at influenza, and they're tied through a researcher. His name is Richard Webby. They're tied directly to the World Health Organization, and they're working actively with the World Health Organization and with an organization in our DHHS called BARDA. And so, I need make sure that I've got them all: University of Wisconsin, CDC, BARDA, St. Jude Hospital, and CEPRL in USDA. All of them are working actively so they can make a bird flu strain that's transmissible in humans, so they can make a vaccine. Because, if you have this pathogen that's been weaponized so it can infect humans, then it's the perfect pathogen to be able to develop a vaccine from. And to me, this makes absolutely no sense. Why are we weaponizing this? Why are we taking it? I mean, literally, they are looking at a way that they can transmit this virus through respiratory droplets from human to human. And we're playing with fire with this gain of function research. And it could very well be that the virus that is circulating right now in the bird population and in the cattle population is from a lab leak. It very could well be. There are other scientists that have hypothesized it. I'm looking at it right now. I'm researching, the hypothesis by looking at the actual genetic sequences of the different strains of bird flu that are going around in the United States to confirm it. I haven't come to a solid conclusion, but we've been playing with fire, and we've been playing with fire with bird flu since the early 2000s.
Well, this kind of reminds me of that. I believe it was Pfizer whistleblower, that Project Veritas video that basically, ended Project Veritas per se. But
Right.
if people aren't familiar with that video, I know it went viral and then it was kind of suppressed a little bit, but there was a Pfizer employee that was talking about them controlling the next strain of the virus, coronavirus, so for the purpose of being able to get ahead of the curve in releasing the vaccine or something along those lines. Am I correct with that?
You're absolutely correct. And when you look at the strategy of the Pfizers of the world, and the Modernas of the world, and the other opportunists in this sort of vaccination realm, if they can vaccinate the entire population of the world. I mean, there were 13 billion COVID-19 shots given to a population of 8 billion. Um, you can make a boatload of money. If you look at Pfizer and Moderna's profits over the coronavirus pandemic, over $100 billion, over $100 billion. Some of their board of directors members became billionaires because of the pandemic. And one of the things that was very, very clear when I started to look into this was that many of the gain of function research scientists also held lucrative patents on vaccine technology that was based on the same sequences that they were weaponizing. And so they stood to make, millions and millions of dollars because of these patents. The BARDA, which is the Biomedical Advanced Research and Development Projects Authority in the HHS, BARDA has a researcher by the name of Rick Bright. He used to be the head of BARDA. He actually was fired from BARDA in 2021. But over his tenure, he developed no less than 20 patents on bird flu vaccines. And he is commercializing those vaccines through a company called Novavax. And Novavax is now in clinical trials for their bird flu vaccine. And the government is paying hundreds of millions of dollars already. I mean, we have 3 cases that did not human to human transmit, but there's already wealth being transferred and money being transferred to these entities to stockpile bird flu vaccines. And the thing that shocked me was even though we didn't have a pandemic, we already have 3 approved bird flu vaccines for human use. And so why is this all being put in place? Why are there already vaccines for a disease that doesn't even exist? And their stockpile, the initial stockpile is going to be 4.8 million vaccines against H5N1 influenza in humans, and it's going to a company called CSL Seqirus, which is providing those vaccines, already FDA approved. And so therefore, if the bird flu pandemic becomes disease X, then these companies stand to make billions and billions of dollars by vaccinating all these individuals with the virus that those same researchers created.
And if you look at Event 201 and you look at, them, and really Mickey Willis had the perfect name for his documentary, A Plandemic, because they planned
Right.
it. And if you look at Event 201, I remember watching it during COVID, during the first couple months of it. And my wife's looking at it or watching these videos, and she's like, "So this came out last year, 2019?" I'm like, "Yep." And she couldn't believe that it wasn't like current video because it was so similar to what was actually going on.
Right.
And yet everybody on TV just kept saying like, "Oh, all our mistakes, all the, prejudging, all the bumps in the road was all because we couldn't have predicted what happened or what was going on." And yet they had a event that was directly, perfectly predicting, and all the same characters were involved. John Hopkins, Bill and Melinda Gates Foundation, and who am I forgetting? And I think the World Economic Forum was a part of it.
Right. World Economic Forum with the World Health Organization. And yes.
It's mind-boggling. I mean, like I said in the beginning, the only good thing that came out of all this was the fact that people are now looking at vaccines as a much more mainstream topic, and people are questioning it. And people, it started off with like questioning the COVID vaccine, and then little by little, it kind of opened people's minds to questioning all vaccines, and that's a
Right.
step in the right direction. But it's amazing because I remember the first time I had you on to share, the CD whistleblower story, and first time I had Del Bigtree on, and
Right. Right.
Field and all, and like this, it was such a fringe topic. Like people wouldn't touch this topic with a 10-foot pole. Like they didn't want anything to do with it because the second you even question it just slightly, people got emotional. People would look at you like you're crazy, and it was just insane. And yet, it was such an important topic, as many of us in this area and have been kind of saying, because it affects all of us, and it affects literally the path of humanity in regards to like how sick people are getting, the increases of autoimmune issues and autism and all these other issues. So it's like, to me, it was kind of, weird to me that so many people in the alternative media community, like, we're talking about geopolitical stuff and talking about, I'm like, there's stuff like that's going on at home affecting your nieces and nephews, and and people that are being born right now, maybe your own kids. And it's like people have to wake up to this. And so when COVID happened, I mean, do you think they overplayed their hand in regards to like the extent that they went to force feeding people a vaccine?
Absolutely. I hope that, these individuals that were pulling the strings of this pandemic are held to account, because it's very obvious what they were doing in order to get an emergency use authorization for the vaccine. So they would withhold any treatment that might be effective. Ivermectin, oh, that's horse paste. Hydroxychloroquine, that's bleach. Um, so many misnomers and so many things, and so many people died, from this lab leak virus, whether it was an intentional or an accidental leak. But it just seems so transparent, and not only transparent to observers who have been watching this for a long time, but really plain as the nose in your face to just the general public. Like, why are they doing this? Why, this is not effective. This is not helping. And why are we, lying in wait until we take this untested technology, this genetic therapy vaccine, if I can even call it that,
They
and
changed,
then foisting it on the public.
right? Didn't they change the definition of a vaccine just to make it fit? Yeah.
Right, right. It changed the definition of the vaccine in order to be able to call it a vaccine, because if it would have been approved as a gene therapy, which would have been more appropriate by the FDA, we'd still be in clinical trials. It would have never made it through, what was done, which was a relative skate, at the expense of the population of the United States and really the world. But what the thing that is so encouraging to me is the number of people that are now questioning the childhood vaccination schedule. The number of people that have questioned the vaccination. I saw one statistic that said in 2019, about 4% of parents were questioning the vaccination schedule. And now, after the pandemic, that's risen to 30% of parents are questioning the vaccination schedule. And, I hate not to put that number in context. I wish I knew a little bit more about what questioning means. But the fact that individuals who came to the forefront during the pandemic, like Pierre Corey and Peter McCullough and Steve Kirsch, now are looking at the entire vaccination schedule. They made the switch. They looked at the information, they made the hard choices, and now they're saying the same thing that, we have been saying for years.
And even people like Brett Weinstein and other people
Exactly.
are now questioning, and Rogan. I mean, he was a perfect example.
Right.
He's been a huge inspiration to why I started my show when I first started in 2013. But one thing that I would always get upset with him about is how he wouldn't give people from the other side of the argument a platform. And it's like, okay, well, if you're having Dr. Hotez on, if you're having these
Right.
idiots on, then why wouldn't you have somebody from the other side? And if you're truly open-minded, you have to be open to this discussion. And then when COVID happened, I was hoping that like, okay, it's just a matter of time before like he starts seeing the light and realizing that like this is just vaccines are no different than all the other big pharma scandals. But for some reason,
Right.
people didn't see it that way. They for that, and we would always joke about this. Like, I don't get it. So the same pharmaceutical companies that have all these fines, that have, just endless amounts of fines for lying about their products or deceiving the public or whatever.
Right. Right.
Pharmaceutical companies put all the moral people in the vaccine department, like, and they don't do any of that. It seems so not logical, but it also shows the power of propaganda. Like at such a young age, you're told that vaccines, save the world, the polio, and all these other things that you hear these fairy tales and these stories because as we know, like I think vaccines get way more credit than they deserve for these things, and I think herd immunity should be getting the credit. But all they get, and then also you're putting them in the little babies, right, newborns. So it's like
Exactly.
this conscious thing, like this. You're just assuming like nobody is evil enough to be giving newborns, every newborn, and suggesting for every newborn to get this if it was actually dangerous. And I think that was the part that I think people would have a hard time grasping. And like for them to accept that, it like shatters their whole worldview. It's like, oh my God, like that this type of evil exists, that you could comprehend the idea of that, like they know that there's a correlation between all these illnesses and sicknesses and whatnot, and there's a correlation between that and these vaccines, and they're still doing it. But I would always open up the discussion with like the hep shot, right? Like, you know, why would a newborn need that? Like it's a sexually
Exactly.
disease. They're not sharing needles. So then it's like I would open the door by pushing that conversation. It's like, okay, they're like, well, yeah, that one I can see why it's not necessary. I'm like, okay, so the same motivation that led them to put on the schedule a vaccine that we all kind of agree isn't necessary. Well, that's the same motivation that would lead them to put all the other vaccines on the schedule. So that was the part that I think people, struggle to understand and now are more open-minded to.
Absolutely. And more word is getting out. I think more individuals are savvy consumers, and it's difficult to find somebody in society that doesn't know somebody that had a vaccine injury, had a COVID-19 vaccine injury, or died as a result of a COVID-19 vaccine. I know a dear friend of my family died of pulmonary embolism because of the COVID-19 vaccine. And there was a professor I'm sorry, Michigan State University, Mark Skidmore, who did a survey-based instrument early on in the pandemic, and he estimated that at that point in the pandemic, that conservatively 300,000 individuals in the United States had already died due to the vaccine. And that was just by doing polling of individuals who knew somebody that died or knew somebody that had really gotten sick because of the COVID-19 shot. Unfortunately, those types of researchers, they put, like myself, you put a target on your back and then you're subject to persecution, but at least the word is getting out and more people are being affected by this. And so they're starting to ask questions, not only for the birth Hep B shot, you start at birth with the Hep B shot, but then you can get 6 to 8 needle sticks at the 2-month well child checkup of these vaccines that have never been tested together.
That's why I think Andrew Wakefield's documentary or movie slash documentary, The Act, was so good
Yes.
because, and I really think it didn't get the attention that it deserved because the way that it slowly started, like you see this couple that's about to have a child start unraveling all the inconsistencies with the history of how these vaccines got on the schedule and during the Reagan administration, how it really kind of sparked all these issues and all that stuff, and then the amount of vaccines, how they consistently increase, and how basically getting a vaccine on the schedule is like printing money, and really. I use this metaphor all the time. I'm like, if you enforce giving everybody peanut butter, there's gonna be some like adverse reactions.
Right.
And some kids are even gonna die. And so I would argue with people, and I'm like, listen, so you're literally telling me that vaccines are safer than peanut butter. Because what you're saying is that we can force everybody to get these same vaccines, and you don't believe that these parents that are having personal experiences with their child cognitively, losing it and getting sick and whatnot, like that was all just coincidental and made up, and they're just, they weren't aware of these cognitive issues before and whatnot. So I'm like, if I gave everybody peanut butter, which most people would say is safe for most people, like there's going to be some casualties, there's going to be some deaths, there's going to be some adverse reactions. So any one cocktail for everybody is going to have some adverse reaction. That's why it was always frustrating when people would be like, vaccines don't cause autism. I'm like, not in everybody. I'm like, just like peanut
Right.
butter is dangerous for everybody, but you can't just use that statement in a general way and say that, like, okay, it just doesn't. Why can't it? Like, to me, it just wasn't logical.
No, it really doesn't make any sense. And as the parent of a vaccine injured child, my son, was injured by his vaccines that he received when he was 15 months of age. And he's now 26 years old, still a non-speaker, does not have the oral motor and has, specific motor deficits because of neurological damage that happened during that day. It really flies in the face when somebody says, "Oh, vaccines don't cause autism," I'm like, well, come to my house. But it is such a farce that we do have this one size fits all vaccination schedule when we have all of these technologies that can show the frank differences between child and child. We can now sequence the entire human genome. And we can do it for individuals. If Ricky and I, if we wanted to go out and get our genome sequenced, we could do it for fairly little cost. Probably be in the thousands of dollars to get our whole genome sequenced. And that shows a frank genetic difference between the two of us. It shows a frank genetic difference between all of us. One of the things that we did with my son early on was we did genetic testing to show, and we showed definitively he should have never received vaccine one. And I took this evidence. I was at the same conference with one Anthony Fauci, and I took this evidence to show him, why my son should have never been vaccinated and why do we still have a one-size-fits-all vaccination schedule. Of course, I made him very uncomfortable. It seemed like he was looking around for security. Probably the last thing that he wanted to talk to was somebody that had a vaccine-injured child, because vaccines had lined his pockets for so many years. And he said, "Oh, well, that's the way to the future." And I showed him all the data. And I said, "Well, really, the future is now. Why aren't we doing this right now?" And then he quietly excused himself, and that was the end of that conversation. But the fallacy of giving everybody peanut butter and saying that they're going to be okay because they've had peanut butter, I'm going to steal that from you, Ricky. Is that okay? Because that's a really, really good analogy.
Oh, absolutely. I hope you do because I think my listeners are sick of me saying it. So I use it all the time because it is such a good way of putting it because it kind of shows the absurdity of this idea that, oh, vaccines can't cause autism or can't, all these health issues in children can't be caused by vaccines. It's like you don't even know what's in vaccines. You don't even know, how they work. But Robert Kennedy Jr. used to be pushing this idea of like removing thimerosal from vaccines, which, by the way, like many people would say, oh, it's completely safe until we proved it wasn't, and so it's like, to me, it's just a perfect way of kind of using something that most people see as harmless, but can easily understand that like even something that is harmless to some can be very dangerous to others.
Absolutely. And I would dare say, I want to go out on a limb here, because I think that there's subclinical damage that's done by every vaccine. And so the thing that you never know is when are you going to hit your toxic tipping point? When I was a child, I think that there were, by the time I was 18 years old, if I would have followed the schedule, and I don't think my parents did follow the schedule, I would have received a total of 10 vaccines by the time I was 18 years of age. Now, if you look at that same parameter and you triple count like the DTP and an MMR, you triple count those, it's as many as 78 vaccines in the same period of time. 78 vaccines in the same period of time, and then 28 vaccines or more. I think when you factor in COVID, it's actually more vaccines given by the first birthday. And so each one of those, we don't know subclinically what it's doing. We really don't know. Nobody's done that characterization. Nobody's done a full run-up of, children, what type of subclinical damage is done by every vaccine. And everybody has their toxic tipping point. But yet, since, you mentioned the Reagan administration and the National Childhood Vaccine Injury Act was enacted in 1986. It was signed by President Reagan. And then vaccine manufacture became a liability-free industry. And so it became open season to add different vaccines to the schedule. And that's where the vaccine schedule became bloated, was through the 1990s, 2000s, and now, to 2024, when we're looking at even more vaccines to add to the schedule. So, the toxic tipping point was different when my son received his vaccines in 1999, but now it's much worse. And I believe that more and more people will be affected by different things like autoimmunity, neurological conditions, ADD, ADHD, autism, recurrent infections. One of the things that we're finding in the research that I've done between vaccinated and unvaccinated children is that the more you vaccinate a child, the more they are susceptible to infections in general. They just become more sickly. So they have things like recurrent ear infections or recurrent upper respiratory infections or recurrent urinary tract infections because you're suppressing their innate immune system with every new vaccine they get.
Yeah, the human body is a amazing piece of machinery that knows how to
Right.
survive. It's been doing it for a long period of time. And if you give it the nutrition and the exercise and the sunlight that it needs, most of us will be okay when we get sick. Most of us,
Right.
it's unhealthy people are the ones who are in danger. And it's funny, I look at vaccines kind of like the same way that the population looks at like getting thin. Like we know how to like get thin. It's like you eat healthy and you exercise and you eat good quality food. But yet, if there's a new pill that says that it will help you lose weight, 100 times faster or whatever, everybody wants that pill. And it's same thing with vaccines. It's like we know how to handle getting sick, right? And it's like you take vitamins and get some vitamin D from the sun, get some vitamin C, maybe supplement with some stuff. You eat food that is nutritionally dense, and then when you do get sick, your body will take care of the rest. But yet
Right.
everybody's like, you know what? Screw all that. That sounds difficult. It's much easier to just get a vaccine and then hope that it's taken care of. And honestly, the vaccine thing has even made me think about. It's opened my mind to pet vaccines, for animals, because
Right.
I've had people say, well, yeah, I get, but they're like, but I still vaccinate my dog. And I'm like, well, like, wouldn't animals kind of be very similar? Have you looked into that correlation between like,
Have.
have you? Okay, because that's
I
interesting.
have. And I we get reports all the time, Children's Health Defense, like my dog got autism from a vaccine. And okay, so dogs don't get autism, but dogs, they watch their behavioral aspects, they watch their physiological aspects, and we've had people that have said that their pets have declined since vaccination. And it's a very, it's a very consistent story. It's something that, obviously we're not Pets Health Defense, we're Children's Health Defense, but it's something that we hear time and time again. And that is, it's another market, the veterinary market. One of the things that I've actually been watching with bird flu is vaccinations that they give to poultry, vaccinations that they give to cattle, vaccinations that they give to other livestock. This is a boom. And with whatever this new disease X is and whatever they're doing with, if this is a pandemic or a plandemic, then they're going after our food supply. There have been over 100 million chickens that have been sacrificed, that have been slaughtered because they've been infected with H5N1. Um, yeah, the veterinary vaccines are big business, and I do believe that there's such a thing as veterinary vaccine injury.
Well, that's the problem with all these things. Once it becomes a industry, it's gonna it has to survive. It has to continue
Right.
profiting. And it's no different than when you hear about politicians who are like, "Hey, I know we don't need more tanks, but I'm gonna vote for this war because my district has factories that are tied into the tank industry." So it's like we need to keep the military industrial complex going. It's like if I make umbrellas for a living, and if I can influence how much it rains, I'm going to try to, make it rain and so I can keep, growing my industry, So it's like, vaccines have become an industry. And once it's a money-making industry, like, and people are profiting from it, they're making a nice living off it, they're
Right.
not going to want it to stop. They want to keep milking that cow. One thing that we have talked about is, vaccines linked to autism and other diseases. But something that I do hear from time to time is like, hey, I have a relative or I know of a child that wasn't vaccinated and has autism or some type of autistic symptoms. What would you say to those people? Like, what other things have you found can also contribute to this hike in autism?
Usually, when you're looking at these individuals, they hyperaccumulate toxins from the environment, and those toxins can be drugs. Those toxins can be heavy metals from the environment. They can be things like pesticides and herbicides, things like Roundup. Dr. Stephanie Senev has done a wonderful job looking at the effects of Roundup and correlating that also to the autism epidemic. And when you look at it, the data, what I see consistently is that among the vaccinated, they're 5 times more likely to get autism than the unvaccinated. So what that means is that, so you have about 80% of the autistic population, a little more than 80% being vaccinated. Well, that still gives you about between 16 and 18% that were unvaccinated. And so, these children are hyper accumulators of toxins. Some of those toxins are the drugs that you use. There's some compelling research regarding the use of Tylenol under the age of 5 years and autism. The work is done by a researcher who's now at the University of North Carolina. His name is William Parker. And he has some very, very compelling evidence that these children are genetically different. They do not have detoxification pathways that are active in young children, but yet other pathways will establish by the time they're age 5. So, Tylenol use between 0 and 5, especially the younger they are. When we tested my son for heavy metals, not only was he loaded with mercury and aluminum from vaccines, but we were picking up antimony from fire retardant that was in his pajamas. I mean, we had to trade in all of his beautiful, baby clothes that he got for the cheap Walmart baby clothes. God bless Walmart. The cheap Walmart baby clothes that didn't have fire retardant in them, because fire retardant is made of a compound called antimony trioxide, and antimony is a toxic heavy metal. Then we were getting arsenic from the water. We were getting uranium from the soil because we lived in the Northwest and there's naturally occurring uranium deposits in the Northwest. And so many different things. There are so many different toxins in the food we eat, in the air we breathe. And with the advent of genetically modified organisms and the fact that genetically modified food substances have been legal to use and legal to consume by humans in the United States since 1996, now we have the glyphosate generation, the Roundup generation that has been exposed to this. And so, we're bombarded with this toxic environment, with our medicines, with our vaccines, with the food we eat, with the air we breathe, with the water that we drink, that, going back to a holistic, healthy lifestyle is really, if you want to prevent having a child getting autism, watch everything that's going into the body and make sure that it is as pure and as natural as possible. Really, because there's an assault on our food, through big ag and big sugar. There's an assault on our medicines and our vaccines through big pharma. There's air pollution, there's water pollution, that we can thank things like big oil. And all of those are stressors. All of those are environmental stressors. If I was to say what's the one cause, I would say it's vaccines. But, there are children, like you said, who have never received a vaccine that get an autism diagnosis.
Yeah, even fluoride is another topic that people kind of laughed at for a long time, and now they're entertaining the idea that like this is ridiculous, the fact that we're putting it into our water when there shows very little to no evidence that it's helping, your dental health at all. But so I remember my kids, like the pediatrician asking if we wanted to do like a fluoride wash or whatever, and I'm just like, why? Like, do you? And I remember asking
The
that.
neurotoxin, yes.
It's just it's insane. But environmentally, yeah, without a doubt, there's a lot of harmful things. It seems like man is constantly screwing up things. Just it's like things. It was a well-oiled machine, and then we just constantly are, and a lot of it is profit motivated.
Right.
I know a lot of my libertarian and free market people would friends of mine, this is where we disagree sometimes, where like they believe that the free market would fix all things. And it's like, well, the free market is all, I had the attorney on my show. I forget his name. He was part of, and I believe he was a part of the lawsuit against DuPont with Bobby Kennedy.
Okay,
Uh,
great.
yeah, and he was he was played in the movie Dark Water, but I had him on about the DuPont poisoning the water and that chemical that they were using in nonstick pans and all that stuff. It's like, why would DuPont do that? Well, it was because they were trying to find, a inexpensive way of disposing of these chemicals, so it was leaking into the water. And why would they hide the studies that show that the stuff they're using in nonstick pans, which eventually would scrape off after enough use and eventually
Right.
get into our systems? And why would they hide that that is harmful? Because they didn't want to get sued. So it's like it's really easy to just constantly point the finger at government, but it's like, the profit motive, it also gets some blame. It's not like if you remove all government, then all of a sudden, these corporations wouldn't try to cut corners for profit, right? Um, and then another really interesting podcast I did years ago was one, and Alan Bell. And he has a book called Poisoned, Crime Busted, Busting Prosecutor Turned into a Medical Mystery in a
Right.
into his crusade for environmental victims. And he was a guy that moved into a new office and ended up getting really sick and ended up having to live in like some wooden cabin in the woods for a long time. And they couldn't figure out what was wrong with him. And it was his body was having a reaction to those synthetic products and chemicals in that new office. And then also another really interesting book kind of on the same topic,
Right.
bit, and Chris Newby, who's also been on the show a few times, about the history of Lyme disease and biological warfare weapons. And I remember first time I had her on, it was pre-COVID, and then I had her back on because I'm like, well, I think your book is more relative than ever, because it really
Right.
is a issue that people have to think about, like all these things, like the bird flu and all these companies literally messing around with Mother Nature and really not knowing the what the end result may be. I just had Dr. Jessica Rose on yesterday, a mutual friend of ours.
Wonderful.
And Jessica's awesome, but we were talking about AI. Was much of our discussion was about AI, and I think these viruses is very similar to AI. Like, I make the same argument that like people are just kind of just so focused on their little work that they're doing, and they're progressing their science or progressing their technology, but it takes people like you and I to like say, hey, we got to zoom out and see, like, this could go down a very dangerous road. And you're so focused in like, oh, it's just gain of function, research, and it's for this reason or that reason. And it's like, sometimes they're so focused in just doing their individual task that they don't zoom out and say like, whoa, I'm a part of what could be a very dangerous thing if this gets out of hand, or if there's some outcome that we didn't predict, which in many cases is the case.
Exactly. Exactly. I was given a gift. I actually interacted with an individual. He was a student of mine when I was teaching at a community college, and he was a veteran, and he was exposed to friendly fire. He was intentionally exposed to a biological agent that had been created by the United States government, and the biological agent is called Mycobacterium fermentans incognitus. And what they did is they took a bacteria that causes pneumonia, called Mycobacterium, causes pneumonia, and they replaced the proteins on the external portion of that bacteria with the HIV protein coat. Well, what the HIV protein coat does is it evades the immune system and eludes the immune system. And so the infection is allowed to take hold over a long period of time, weeks longer, before the immune system is even aware that the body is infected. And he was neurologically damaged for life. The mycobacterium actually affected his nerve system and got into the neural ganglia. and he was neurologically impaired for the rest of his life. He would not hold down a job. He decided he wanted to better himself. He wanted to go to community college, so he ended up doing this. But these types of research projects have been going on for years and years and years. Since Operation Paperclip and even before, has the United States been developing biological weapons. I'm sure Lyme is no exception.
Oh, Lyme, and that's exactly what Chris Newby found was that Lyme
Right.
disease was more than likely man-made, which makes sense because there's so much mystery behind it. And, again, like all these conspiracies about like, oh, did Lyme disease come from Plum Island, which is off the coast of Lyme, Connecticut, where they're doing all this, experimental research and sketchy stuff. And, a long time ago, the only time you would hear these discussions seriously entertained was, on the Alex Jones show. Now it's, people are much more open to this idea that we're messing around with Mother Nature and there could be some consequences because of that. And, but again, anytime there's a tragic thing that happens, like a virus gets let loose onto the public, somebody's going to try to profit from it. And, they're going to try to, force feed you some experimental mRNA gene therapy vaccine, which is what it probably should have been called. And, so it's funny how some people still, struggle. I remember during COVID, I had Dr. Robert Lusting on, and I'm a big
Mhm.
fan of having, health and nutrition people on, and really, because I think like all these topics are related more or less because it's all about like, hey, improving your health and trying to live the natural way. And he does great work on the sugar industry, right?
Right.
And food industry and big food and all this stuff. And we did a whole show on the food industry and on, how important eating right is and how we've been lied to about what we should be eating and whatnot. And then at the very end, I forgot how it happened, but the vaccine got brought up, and this was it must have been some time after it was introduced to the public. And
Right.
well, it's like people should get vaccinated, and I'm like
What?
debating with him, right? And I'm just like, it was amazing to me how he could see all the corruption and conspiracies in the food industry, but completely was naive to it in the pharma industry and like and or at least specifically in the vaccine industry. It's like, so wait, you see how profit can push out bad information and they can lie to the public and really how many people are diabetic or obese or whatever because they were doing what the food pyramid told them to do, and that's eat carbs
Exactly.
stuff and told not to worry about sugar. So many people have health issues because of the lies we've been told, and yet you trust the vaccine company. And then I even told them, like, Moderna is not a vaccine company; they're a gene therapy company. They don't make vaccines, and and it was just funny because it's like in so many cases I see this issue where, I remember when I had Dennis McKenna on, I've told the story a few times where I've had Dennis McKenna on quite a few times. First time I had him on, he was like, all we talked about was plant medicines and all the amazing research he does on plant
Right.
medicines
Right.
and whatnot. And then I think it was the second or third time I had him on, he, it was during the election time. And like he went on this like anti-Trump pro, I don't know which one. I don't know if it was when Trump went against Hillary or Biden, but he went on this anti-Trump pro left wing, person rant, and I'm thinking to myself, I'm like, dude, like even with all the psychedelics you do and mushrooms and all the things, I'm like, you still could not cut through the propaganda. And vaccines kind of was a similar thing where like no matter how open-minded somebody was to so many different things, like vaccines was the one issue and topic you couldn't get people to see and accept the corruption. And the reason why I bring up the Dennis McKenna thing is because Rogan would constantly say, like, oh, if we just give everybody psychedelics, like we'd be in a better place. And I'm just thinking to myself, I'm like, well, Dennis McKenna has done tons of psychedelics, and he still is, can be brainwashed by the propaganda and be motivated and influenced by the propaganda. So that's why people like yourself and Del Bigtree and all these people who, Dr. Wakefield, who, lost his career because of this topic.
Absolutely.
I know people, and people are always like, oh, there's so much money in the anti-vax world, and that was kind of some of the narrative that they were trying to push during when Robert Kennedy was first running. I'm like, how about all the money in the vaccine world? I'm like, so it like God forbid somebody who says like, hey, eating healthy is good. By the way, like if you want to, supplement, if you want to take this natural remedy, like I'll sell it to you, which there's very little money in vitamins and natural remedies anyways, because
Right.
you can't
There's
patent,
no patent space there. No.
but yet the vaccine and big pharma companies can make billions and billions of dollars, and nobody is saying like, hey, look what scumbags they are making all this money off this stuff. So it's just it's not a fair, fight. And people are now starting to see that like, hey, maybe Robert Kennedy Jr. wasn't trying to make money for his nonprofit organization, but what he was and Del Bigtree, I know there was that article, and Del even talked about it on the High Wire about like,
Hmm.
that article that talked about, his salary and whatnot. And I didn't have any problem with it. I'm like, this guy travels all over the world. He was just in Geneva, um,
Right.
not too long ago. I remember meeting him at the Red Pill Expo in 2019. Well, I shouldn't say I met him. I said hi to him. He's very popular everywhere he goes. It was catchy.
Yeah, it's kind of hard to get FaceTime with Dell. Yes.
Exactly. But I'm like, this guy's going everywhere. He battles the fight. He was going against the grain when it was really hard to do so. Now I think it's a little easier for people to come out and be anti-vax, but at the time it was very hard to do so. And he was well spoken. He was willing to debate and talk to anybody. He was willing to travel everywhere. And I'm like, okay, so he makes a living doing it. That's great. You know who makes way more money than him? All these scumbags that are trying to put more vaccines on the schedule, knowing, and most of them do know. I mean, just like during the Fauci emails that got exposed and all this stuff, like these aren't just naive people that are doing harm accidentally. Like they're covering their tracks. They know exactly what they're doing. You talked about meeting Fauci. Was it actually the same time that Del Bigtree met Fauci? Was that the same?
No, it was a much earlier. This was, gosh, this was probably back when my son was maybe 6, 7 years old. So it would have been 2004, 2005. So that was a long, long time ago.
Yeah, and you know what? That's the thing about like Trump. I know a lot of people are like, "Oh, he pushed warp speed." I'm like, "Yeah, he did. You're right, and he should get blamed for that." But he also was the only president that I know ever to say, "Hey, Robert Kennedy Jr., how about you come in and maybe we discuss you potentially helping me out with this vaccine topic?" And he met with him, right? I believe he
Right.
brought him in. He met with him. He's openly during debates questioned it, and I mean, I remember like to me, like it was a huge deal, and I'm sure it was for you too, when like during a debate, he stuck by his guns, even though politically he knew it wasn't really a great move to stick by your guns on.
Right.
But he said, yeah, I think that like there could be, when all these parents are saying that their kids got autism from these vaccines, I think people should be asking questions, and I think that maybe they're getting too many vaccines. I'm like, and on a mainstream, media channel during a debate that all these people are watching, and a person that like was pretty popular at the time, I'm like, wow, I'm like, he might be opening a lot of people's eyes to this topic that are hardcore Trumpers. And they're like, you know what? I like Trump. If he's saying this, maybe there's something to this, And so I got to give him credit. I mean, do you know of any other president that has ever questioned vaccines?
Well, I know of who I would think would be a good future president to who's questioned vaccines. One of the things that was interesting about the debate too was that not only did Trump say that about vaccines, but he also got Ben Carson to concede it as well, a medical doctor to concede that as well. I think people really need to go back and look at that time in history as and I am thankful for that. I'm thankful for him and the things that he's done. Yeah, we can talk about speed until the cows come home as well. But he was also not going to mandate the vaccines. He was not going to mandate the vaccines. And I tread lightly in this area because I'm, 501(c)(3), a not-for-profit. And so we don't get involved in politics, but I think it's important that you look at these things, and the things that you're saying, Ricky, are so important because you're such a good observer of what's happening and what's going on around you. And it's so easy to get myopic in one area And you know, um, I had to come face to face with GMOs because I used to do genetically modified plants for a living. That was, I worked at the Department of Energy National Laboratory. Fortunately, I never worked on food substances. We only worked on plants to make pharmaceuticals. But the whole GMO thing, I got caught up in that in the mid to late 1990s. And so I had my own waking up moment too, even though it would probably have been more profitable and lucrative if I would have stayed in that research. But I had to wake up in that area as well as in vaccines, as well as in big sugar, as well as in the chemicals that they put in our food. You know, things that are like aspartame that is in so much in as an artificial sweetener, sucralose, which is basically when you take sucrose and you substitute chlorine instead of hydrogen on the molecule. There's so many different things that we need to wake up to, we need to look at, and the government has not earned our trust to tell us to put anything in our bodies. You never trust the government to tell you what to put in your body. And so, to me, what I do every day is associated with the vaccine issue, but there are so many different issues and there's so many different fronts where you just have to stay alert.
Yeah, even with the GMO thing,
Yes.
doctors were demonized. What was that French doctor? He did the study with the mice, Dr. Cirilini. Uh,
Yeah, I remember. I'm familiar with the name.
he-
But yeah, you look at the survival rate of generations of mice, and it basically drove the mice to extinction. And there's so many different things like that. And you look at the aspects of genetic modification and the promise that we were told, oh well, this is going to feed, this is going to do away with starvation, this is going to make it so you can have sub-Saharan Africa flourish. That's not what's happened. We've just made a bunch of people a lot of money through GMOs, through the sale of Roundup, through the sale of Roundup Ready seeds, through the sale of BT crops that have BT insecticide in them, but we're finding that toxin even in the cord blood of pregnant women. There's so many things that we were promised with the GMO revolution, and all that came to fruition is that rich people got richer.
well, have you looked into that new product that they spray on fruit to make it last longer so it doesn't ripe as quickly?
Oh,
They're
what's that called? Oh, I know what you're talking about. It's
yeah,
not Atlar, it's something different.
yeah, I can't remember what it's called either, but I'm like, where's the testing of this stuff? Like, how are we going to start spraying this stuff on food and not know what the long-term consequences are? And that's the thing with all these things. It's like they just throw it out there and they don't worry about the long-term consequences. And it is, I mean, that's where the libertarians are right, because government and big corporation are in bed together. And that's what, makes these issues so dangerous and so concerning, is that when the regulators are working for the big corporations that they're supposed to be regulating, then basically there's nobody to stop them from doing these things.
Right. Right. The fox is guarding the hen house.
Yep.
Look at the FDA, 45% of all revenues of the FDA come from big pharma. Big pharma through the fast track program. That's how they make their money. And so, of course, the FDA is going to, big pharma says jump and FDA says how high. And that's one of the reasons that we got into such a mess during the COVID-19 pandemic.
Yeah, and I guess the concern, I think, where the libertarians are also right, and again, I'm like you, I'm politically homeless. I just like to look at ideas. I'm much like yourself, like I will call it how I see it. I'm not
Right.
Trump, but you cannot take away the fact that that debate did happen, and he did, like you said, he even had Dr. Carson even admit on TV that, like, he even swayed him. He's like, and I think Trump was like just basically saying, he's like, you got to admit, like, there's too many vaccines for these little kids, and
On
even
the schedule. Right.
said it on TV. He's like, yeah, I think in regards to that, I think he's right. He's like, I think that maybe we should look into how many vaccines children are getting. And I'm just like, oh my God, like he literally just got somebody who wasn't even anti-vaccine at all to at least entertain the idea that maybe we should look into this. So yeah, like I said, I'm not pro Trump, but you can't only look at one thing he did and not the other things, and
Exactly.
you know.
Exactly. No,
So
I totally agree with you.
have you looked into, I know I've had a lot of people ask me about the chemtrails and this idea that like everybody's saying that they're seeing it everywhere. Have you ever looked into that topic specifically just in regards to the seeding and the maybe getting the chemicals that are causing a lot of our health issues, getting it into our system via chemtrails?
Yes, I have. I live in the same community of sort of the guru of chemtrails. His name is Dane Wigington. We both live in Redding, California, and so I come by it naturally. And I'm a big fan of Dane's, and I believe that the geoengineering work, until I saw it with my own eyes, and it wasn't looking up at the sky. It was actually looking at websites where people were doing this experimentally and seeing that they were flying over the skies. The particular website that I saw was over Reno, Nevada, where they were doing specific spraying of aluminum particulates in that area. And then knowing individuals who've worked with Dane who have actually gone up and tested the different layers of the atmosphere for these particulates, they're finding them, and there's no natural reason for them to be there. So yeah, they're spraying particulates, they're doing weather modification, they're doing, quote unquote geoengineering, and it's hiding in plain sight. You can find the websites. I wish I had some references on the top of my head. Again, I've got like vaccines on the brain, but I remember looking, I was tipped off by somebody who is a supporter of CHD and was talking about this phenomenon in the Reno, Nevada area. And I went directly to the website where they showed that they had received a permit in order to do this type of experiment over the skies over that particular area. I believe that it was more closer to Lake Tahoe, so it was on the California side. So it was a California website that I saw, but you can see it. It's right there in plain sight.
Yeah, I think that's another, you can add that one to the list of things that were conspiracy theories that now people are entertaining. And it's funny because they would use terms like geoengineering, like it was different than chemtrails. They would call the chemtrails people crazy, and then they would openly discuss geoengineering. And I'm like, wait, isn't that what the chemtrails people are talking about? The only difference is you're using a more scientific sounding term, which
Right.
apparently that's all it takes to confuse people, so that's wild. But so back to the vaccine thing, because of the things we discussed, like hey, like people are now opening their eyes to vaccines. I think in the future it's going to get harder and harder to mandate these things, hopefully. And
Yes.
do you see the vaccine battle like us winning in regards to these things? Do you think like, there's going to be so much pushback that they're going to have to go to some plan B? And if not, if you think they're still going to be pushing this, and because there are a lot of conversations about like normalizing mRNA technology, right? And then
Right.
what door that opens. Do you think that's the next chapter in all this?
Well, I wouldn't be a part of this battle unless I thought could be won. And so this is one of the reasons why I do this every day, Ricky, is because I do believe that we can win the battle. I do believe that we are winning the battle. And we're looking at, like the Ninth Circuit court just basically ruled that essentially that the mRNA vaccines were an imperfect technology, and so the Jacobson ruling regarding, immunity and vaccines conferring immunity in individuals doesn't apply to the COVID-19 shot. And so, they're using this on appeal basically to overturn another decision. So they haven't completely overturned that decision, but it's really, really important that now that the Ninth Circuit Court has stated that vaccines that in their opinion, the vaccine mandates are only if the vaccines are 100% effective. I mean, this is really, really huge. This is a huge, huge court case. And although it doesn't, there's still several hoops that need to be jumped through in order to overturn the mandates that are being fought out in the Court of Appeals right now. More and more individuals are waking up. More and more people are realizing, yeah, I got the COVID vaccine and I got COVID. I've heard that over and over and over again. So a lot of people are throwing up their arms and saying, well, why did I get it in the first place? I ended up getting COVID. And we know that it didn't provide sterilizing immunity. It didn't, but yet um, uh, it's a narrative that they pushed. The more and more times that they have individuals like Anthony Fauci and Peter Daszak testifying on Capitol Hill, the better off it gets for us because the lies are being undone and are being exposed to the public. And so, yeah, I think this is a winnable battle.
Yeah, it's crazy. Every time I reflect on the COVID era, it still boggles my mind what people accepted. You couldn't leave the house, you couldn't go to work, you couldn't gather with family members on holidays. You were masking kids, petrifying kids of being around other people and whatnot. And like it just when Dave Smith was, I don't know if you saw the debate with him and Cuomo, like
Right.
I'm so glad Cuomo was getting crap because he's a perfect example of how these liars are so used to lying that it doesn't phase them at all. There is no moral compass that gets in the way
Oh,
of.
no,
I mean,
no.
it's like when they were showing videos of Fauci saying, like, hey, this is going to stop you from getting the virus. This is going to stop you from spreading the virus. You're doing this for as a moral thing to help others. It's not a selfish act. It's a unselfish act because you're helping others. And if people aren't getting it, then they're selfish and all this stuff. And it's like, and then he goes back and says, oh, we never, Fauci later in videos goes, oh, well, we never mandated it, or we never said that, you couldn't get it or you couldn't spread or whatever. It's like you lied about the product over and over and over again. And everybody on TV lied about the product over and over again. And then yet, people like myself who got kicked off of YouTube and
Right,
Robert Kennedy Jr. who got kicked off everything,
right, right.
they're being called liars and misinformation, disinformation, all this stuff. And yet, like, you can't prove that they're lying about anything. But Dr. Fauci has interview after interview after interview of him lying about a product and basically suggesting to enforce it. And so to me, and then the emails, like I said, the emails that showed that they were covering their tracks, that there was,
Right.
all these things. It's like, and yet this guy is still alive and well and free to roam the streets, even though he openly, I mean, there's video evidence of it. That's the thing that drives me nuts. It's like you literally can see the videos of him lying about it, and it just, and then Biden lying about it, right? Like, and then
Right, right.
the whole theater of him getting a vaccine on live TV, even though the whole background was all theater. And I you're supposed to sit down when you get vaccinated, anyways. I don't know because I've never had a vaccine as an adult, but they're told that when you get the COVID vaccine, you're supposed to sit down because you could get dizzy or whatever. So it's like you think they just shot Biden on TV in front of the world? Potentially, he could have adverse reaction and just ruin the whole vaccine agenda. They would risk that on live TV. Of course, they didn't. Like, so they even
Of
put on
course not.
a theater, a show. They lied to you about the whole thing, and it just. I know so many people just want to move on from this topic, but the problem, and I was having this discussion with my wife the other day. I'm like, the problem with like just moving on from this is that us being naive and neglecting what's going on is what led us down that road in the first place. That's why we're stuck where we were, because so many people weren't listening when Dr. Brian Hooker was saying, hey, this is a topic you need to pay attention to. Hey, look at the actual science, look at the actual evidence, and look at all the evidence of them lying and deceiving. And And yet, like, people are like, no, I just want to go to dinner. I just want to live my life. Leave me alone. I don't want to get involved in this topic. And then next thing you know, it was too late. Our whole world was crashing down. And personally,
Mhm.
I've been saying it's the biggest event in human history. And the reason why I say that is because it's the only event in human history that included everybody on the planet, that everybody on the planet has a experience related to the COVID pandemic. So to me, it's like the greatest event in human history, and nobody wants to like lock anybody up or or make somebody responsible. Make sure whoever is responsible for this gets gets some time or something. No, they don't want another Nuremberg. Like we should have another Nuremberg. Like there should be
Oh,
people.
absolutely.
I mean, what's your thoughts on that? I'm sorry, I'm getting worked up. Just talking about it makes me relive the frustration that I lived through during COVID.
Oh, I think we need Nuremberg 2.0 now more than ever. If we are going to come out of this without a destiny of repeating this thing over and over and over again, then those people that lied to us need to be held to account. And those people that looked the other way when just massive amounts of vaccine injuries were being reported to the CDC's VAERS database and saying, oh, well, VAERS is unpredictable. And CDC would go through these VAERS reports and they would come up with some preposterous language like, well, there's never really been a death to the COVID-19 shot. Give me a break. Really? All you have to do is peruse the website and see anaphylaxis, cardiac arrest, ischemic stroke over and over and over again. So yeah, would I like to see Tony Fauci brought to justice? Would I like to see Francis Collins brought to justice? Would I like to see Peter Daszak and Ralph Baric, who did the gain of function research? And then hit his results. I was doing some research on a paper that Ralph Baric did. He's the gain of function guru at the University of North Carolina, with Zhengli Shi, who is the bat lady from the Wuhan Institute of Virology. They published a paper in 2016 under an NIH grant. And they talked about the potential of humanization of bat coronaviruses in that particular paper. When you do that, you're supposed to take all the sequences that you find and all the sequences that you create and deposit that into a bank called GenBank. Okay, and that information goes into part of the National Library of Medicine, goes into the GenBank. They have never submitted their sequences from that 2016 paper. Never submitted their sequence information. And so I'm trying to FOIA it right now. I'm trying to get it via the FOIA. We've submitted FOIA requests to get it. It is a National Institutes of Health grant. It's my government taxpayer dollars that went to the Wuhan Institute of Virology and to the University of North Carolina that could pay for this. You better believe there should be a new Nuremberg 2.0. Think of all the people that had died.
Oh, it's insane. And just the cases of everything is going up. And
Yes.
to think that there's no correlation, that the fact that there's no correlation between like all these young people that are dying, having heart attacks, passing out, athletes, musicians, like just over and over again. And I'm certain probably a little bit of it could be we're paying a little bit more attention, but a lot of it is it's also happening more often. And that's I've been a sports fan forever. I've watched soccer, basketball, MMA for a long time. I can't recall ever seeing a athlete pass out, while doing their profession, never mind
Right.
it happening all the time. And it's literally happening all the time. And it's rarely reported on. I remember watching the English Premier League game. There was a Tottenham game where they had to stop the game. Somebody had like a stroke or passed out in the crowd, and like nobody talked about it. I'm like, why isn't somebody reporting on this? Like this is like not normal. This shouldn't be
Right. Right.
like
Nothing to see here. Right.
yeah, and it's like so over and over again, people just kind of ignore it, and it takes people to kind of connect the dots for people to kind of realize like okay, like it takes somebody like Edward Dowd who started giving you the numbers and showing you that there's something weird going on here, and you can't deny that much, right?
No, no, you can't. I mean, I love the book Died Suddenly. And it's so eye-opening. And we went early into what's called DMED, the Department of Defense Medical Epidemiological Database, and just seeing the uptick in cancers, seeing the uptick in cardiac issues, and then seeing the normalization of things like myocarditis in children. All of a sudden hospitals are advertising that they will treat myocarditis in your child. That really wasn't a thing before the COVID pandemic, you know. But yet they were seeing it in the rate of myocarditis increased at least fivefold nationwide in the pediatric population over the COVID-19 pandemic. Fivefold increase in that. That just doesn't, that's not a naturally occurring phenomenon. Something happened.
And I know some people are going to say, well, we just didn't know. Everybody was scared and we didn't know. It's like, no, we did know.
We did
People like
know.
yourself were speaking out. Robert Kennedy Jr. was speaking out. Everybody who was going against the grain was being muzzled, and they were not letting you hear the other side of the story. People like Dr. Robert Malone, who I had on my podcast, was, actually, I think it was that episode that finally got me squashed from YouTube.
Platform.
But it was like, wait, how can you say medical misinformation? This guy, I'd love to see the resume and what makes the person that is flagging my show. I'd love to see what their expertise are and why their opinion on if this is medical or not medical misinformation, and why their opinion is more valid than the guy who contributed to the technology itself. And people like Erin Marie, who I had on my show, who's the nurse whistleblower in the New York hospital,
Right.
doc,
Right.
or Brooke Jackson, who I had on the show, who was the Pfizer whistleblower. She was a part of the vaccine studies. Dr. Scott Jensen, who was kind of blowing the horn on like how they're inflating the numbers. So it's like all these people who, when people are like, we didn't know, I'm like, I had people on all the time who knew, and we're trying to let you know, like, there's something going on here. And I mean, how about, speaking of Cuomo, one thing that I wish Dave Smith brought up and he didn't, was the fact that Cuomo's brother made it illegal to prescribe, was it a hydroxychloroquine or ivermectin? One or two, maybe both. Who
I
knows?
can't remember 20. Right. Right. And he put everybody on ventilators in the New York City hospitals and they died.
And yeah, and he made it illegal for a doctor to decide what medication, what drug they want to give to their patient. Why would a politician get involved in that interaction unless it was political? So, that, and I remember having Dr. Peter McCullough on talking about, I don't know if it was like the ivermectin factory or
Right. Right.
like blew up in flames mysteriously. Like there was all these things that were going on that like were huge question marks. I remember Instagram pages that were dedicated to people going into hospitals that were supposedly, lines out the door backed up, and everybody just filming these hospitals and like, hey, there's no line, there's no pandemic going on. And it was like Instagram pages that was dedicated for people sharing these videos. And I'm just like, exactly. That's exactly right. Like if you turn off the TV, the pandemic is not going on. The hospitals are not backed up. There are not dead people on in the streets. How about we talk about, okay, who the hell said it was okay to circulate probably a fake video, or who knows what was going on, that those Chinese videos of people just dying on the street, past,
Right.
and then saying that was because of this virus that was now coming to America. Like you literally were scaring the crap out of the public on purpose. It wasn't accidental. You knew the numbers were being inflated. We knew about the cycles, right? We knew that there were ramping up the cycles for false positives, all this stuff. And and really they scared the public so much that all logic went out the window. They do it during war times, right? September 11th happened. They started scaring you about anthrax. And then it's like, hey, let's go into Iraq. What does Iraq have to do with, September 11th and, and these anthrax scares? Well, nothing, but we're so afraid that we'll just buy into it, and that's exactly what happened during COVID. They understood that if you scare people enough, all logic goes out the window.
Absolutely. There was so much of so much of that now is being purveyed by those people who would be in line to profit the most from bird flu. And you're starting to see that these sort of voices in the wilderness, and then you look at the voices in the wilderness and you look them up at the United States Patent and Trademark Office, USPTO.gov, and you see how many patents they own for bird flu vaccines. And all of these technologies that could make them, multimillionaires, if not billionaires, in a very, very short period of time. And it's really unfortunate that we were duped in such an amazing, spectacular way during COVID-19, and that they were so dogged at censoring the voices of those individuals that would dissent. And I remember getting my ivermectin prescription filled at Walgreens, and so then it came time to get a refill. And so I called up my local Walgreens to get my refill of ivermectin. And uh, I did it through the automated system. The next phone call that I got was from Walgreens corporate. And Walgreens corporate calls me and says, "Well, we're no longer stocking ivermectin. Can I ask what that was prescribed for?" And I said, "No, it's not your business. My doctor prescribed it. Can I ask who your doctor is?" "Well, it's right around the prescription. All you have to do is read it." So, it was weird. It was like I was getting, called into the principal's office because all I wanted was a refill of my freaking ivermectin. And you would have thought that, I was some type of eco-terrorist because I was putting ivermectin in my body which had been shown to be effective against SARS-CoV-2.
And people have to speak out. I know so many people that I've had private conversations with that's talked about
Yes.
themselves or loved ones who like I haven't felt the same since I got vaccinated, or
Right.
my energy level, or I had some weird stroke, or I passed out, or something. And it's like people have to be open to discussing this because Jessica Sada, who is one of the Pussycat Dolls, she's been on the show.
Right. Right.
Obviously she's somewhat of a celebrity who is speaking out, but we need more and more people to be open to discussing this because, there are a lot of people out there and some people who are naive that it's related to the vaccine. So there's people that they're like, oh, like this is going on with their health. And I'm like, well, don't you think it could be like maybe related to those 12 boosters you took? And it's no, like, no, it's not related at all. The doctor said it's not related. I'm like, okay, but all these health issues start happening after you started getting these boosters and COVID vaccines. So I think there are some people who are still in denial that it's real.
Exactly.
They don't want to believe that, there were potentially, did something that could have some long-term negative effects. But, there's no shame in saying like, hey, I got duped and they lied to you. And it's no different than when I talk to parents. I remember first time you were on my show, I had a close friend of mine reach out and like, I feel so guilty vaccinating my kids after hearing that episode. And I'm like, don't, because it's not your fault. Your decision was based on the information you have access to, and you had access to one-sided bad information. And what you should be is not mad at yourself. You should be mad at the people who are suppressing people like Dr. Hooker and suppressing the other side of the argument. So I think, that's the part that people need to really focus on. It's like get upset with the people that aren't letting you hear all sides of the argument.
Absolutely. Censorship and suppression of science is, and there were so many misnomers that were thrown around during the pandemic. When Anthony Fauci declared that he was science, I didn't know that science was an embodiment of a person. And other individuals that said, well, if you're questioning me, then you're questioning the authorities. And it seemed like whenever you heard that, it was in response to a question that made them uncomfortable, or a question that they didn't really want to answer. I think that we need to get to the point where we're beyond questions making us uncomfortable. I mean, I've been doing scientific inquiry for the last 35 years of my life. And so a question should never make me uncomfortable. That's just part of the scientific process. Um, but yet we found so many people being so offended by questioning, well, why can't we take hydroxychloroquine? Why can't we take ivermectin? Why do we have to wait for the vaccine? Why can't we come up with some type of therapy? Why is it that whenever Tony Fauci recommends something, it's something that he has a patent for or that he stands to gain money for? You know, these are questions that everybody should feel comfortable asking. And I tell people all the time, if you don't feel comfortable asking your doctor a question about something that they want to do or something that they want to prescribe for you, it's time for you to find a new doctor. It really is. I mean, you are the consumer. They are the vendor, and they work for you. They do work for you. And so if you're in a relationship with a provider that you feel uncomfortable asking a question, that's a dysfunctional relationship. I just get out of it.
Yeah, and I know there's a lot of those people out there because I asked too many questions in regards to my pediatrician and pushed back, and now we have new pediatricians because I got a letter.
Good job. Good job.
Yeah, well, I wasn't welcome back because I was questioning their authority, and we live in a world of the internet. Like you're not there's not a monopoly on information. Like I can look things up too, and in many cases, you're so caught up in your job and just basically regurgitating the information that they give you that you're not even researching things. You're just regurgitating information that you're given. So, I might be better informed than you if I'm curious enough to
Exactly.
look into it. So, without a doubt. But I know I've taken up a lot of your time, and I can't thank you enough for taking so much time out of your day to share these long-winded rants with me. And and for people listening who want to keep up with your work, want to keep up with your maybe social media platforms that you're active on, and anything new that you might be having come out or release soon, share anything and everything.
Well, the best way to get information from me is through children'shealthdefense.org. That's a great resource. You can also, there's a tab for you to find out more about the book that I co-wrote with Robert F. Kennedy Jr., Vax on Vax, Let the Science Speak. And you can follow me on Twitter at Brian Hooker, PhD, as well as Instagram at Brian Hooker, PhD. And I think also now on Facebook. I think I all got them aligned. And I'm not in Facebook jail currently, so that's a good thing. I guess. I don't know. Maybe I'm not doing my job. I should be in Facebook jail. But Ricky, thank you so much. It's always such a pleasure being on your show. You think so logically and you ask such good questions. So please keep doing what you're doing.
I'm trying. My full-time job and family life gets in the way quite a bit. I definitely try this has always been, much like yourself, one of the topics that I've been very passionate about. And even before I had kids, I was very passionate about this topic because once I realized what was going on, I'm like, how aren't people screaming and upset and like I just knowing how dangerous this is, this idea of constantly vaccinating kids and adding more vaccines to the schedule and everybody just doing it and having faith that no harm is going to come out of it was just it seemed surreal to me. And but you get a lot of the credit, you and many others who to open my eyes to this topic and really for all these years really just focusing on this specific topic. And Dell, another mutual friend, has done great work, and Brian Festa and so many people. I mean, there's
Oh,
just so many
love
great.
Brian.
Yeah, Brian's awesome. I mean, there's just so many great people in this world, and I just think that it's awesome that for a lack of a better term, like I think we're winning, and I think people are waking up to this topic, and like you said, if we didn't have faith that we could win, we probably would have given up and just taken the what is it, the blue pill, right, instead of the red pill.
Blue pill, exactly.
So, but thank you so much, Dr. Hooker. We'll have to do this again very soon and hopefully in the near future and keep in touch and keep fighting the good fight. We really appreciate all the hard work you put into this topic.
Well, thanks again, Ricky. Appreciate it.
Thanks. Take care. We'll talk soon.